My name is Josephine Probert, and I am the stepdaughter of Garrett Edmund Burger. My stepfather, he just passed away a month ago. On the 18th was 1 month he passed. He was admitted on the 8th of June to Groote Hospital. He had a bit of throat infection. So when they admitted him on the Friday, he went to the clinic in Athlone and he took a COVID test to see if he's COVID positive. He took the test and he was waiting for his results. But then on the Monday, my mother took him to the hospital because he was feeling very weak. So going to Groote, every day I would phone and I would ask the update on my father's health, and they would say to me, he's getting better, he's very chatty and things like that. Then 3-4 days later they say to me that he is very disorientated. When I've called the doctor and asked for an update, they say he's very disorientated, speaking confusing, and is very dehydrated. So I said to the doctor, but how can you say that? You know that Mr. Burger has got sugar diabetes and you're supposed to treat him for his sugar diabetes. That is why he's confused, and that is why he's disorientated, and that is why he's dehydrated. You have to put him a drip on. I should not be telling you that. You are a doctor. I did not study medical. You should know to put him a drip on. The evening when I called, they said they put him a drip on. I asked the nurse, how is he? She said he's doing better than the afternoon. The next day I called, it was the Sunday. I called and the doctor gave me an update, and she said to me, would I like to speak to Mr. Burger? And I said, yes, I would like to speak to him. Can you take the phone to him? So she took the phone to him and I spoke to him, and he said to me that we must bring him bananas and oranges, and we must bring his teeth because he can't eat properly without his teeth, and juice. So we took the juice, the bananas and the oranges. That was the Sunday. The Monday the doctor spoke to me again. He says Mr. Burger is fine. Tuesday he's fine. The Wednesday, when I spoke to the doctor, he said Mr. Burger's sugar is very high and his cholesterol is very high and his hypertension is out of control. So I spoke to the doctor at 12 o'clock. He said Mr. Burger is, they're going to treat him for his sugar because he's very dehydrated. 2 o'clock I phoned the doctor again and I said, how is the update on my father? How is sugar levels? Then he was telling me they're going to put my father on the steroid medication that helps, well, that will help him a lot. So that was 2 o'clock. The Thursday morning they phone us 2 o'clock and say that Mr. Burger passed away 12 o'clock the previous day, the afternoon. So I said, but how can that be? When I spoke to the doctor at 12, I spoke to the doctor at 2 o'clock. I've got the history of the call, and the doctor told me about the steroid he's going to put my father. And so how come you call me to say he's passed away the previous day? I said, even that on the 17th, 5 o'clock, my daughter called the doctor and asked, can my mother not see her husband? She will take the risk, whatever the risk is. She just wants to see her husband. And you said to me, your father is sleeping, and now you tell me that he has already passed away 12 o'clock the previous day on the 17th of June. I said, then why are you giving me this news? You are the night shift nurse, and you telling me something that the day shift nurse should have told me. I said to her, because you came to work at 6:30, settled down at 7, and it's 2 o'clock in the morning. When she called me 2 o'clock Thursday morning, she said his body's already by FBOB. We must collect his body. The whole time, they did not want us to come in the ward. An hour after they gave us the news that my father has passed away, my daughter and my sister went to Groote to pick up his belongings. It's so funny. They could walk straight into my father, into Grooterskia, into the ward, straight to his bed to pick up his bag of belongings. The same ward they say is COVID ward. They didn't sanitize their hands. The nurses never say, said, there's your father's things, pick it up from the bed. So my daughter said, the whole time we've been asking you guys if we can see him, you're telling us about it is a COVID ward. Why are we allowed now to come in this COVID ward, to come straight to his bed? Did the COVID now die because Mr. Burger is dead out of the ward? Nevertheless, we got his belongings. The 2 days later, my mother said, when am I going to identify my husband's face to see it is him? They said they can't show us his face because he's been wrapped so tight into cling wrap. 1,000 cling wrap has been wrapped around him. That's what the undertaker told us. So my mother said, no, who to say that is my husband there? So the undertaker said, no, it is your husband. Because why they called me, and the tag was Garrett Edmund Burger. We don't even know if this is him laying here, but we just take it is him. We just out of respect, you know, for my mother, and that she took it very hard because she couldn't identify her husband's face. We buried him. 3 days later, I went back to the clinic where he took his COVID test. I said, no, let me see the results. We have the proof at home. The results is negative. No COVID. But they treated him, his whole body, the whole hospital thing, with as a COVID thing. No COVID, but test came back negative. That's not even the half of the story. We found between his belongings a week later, we found a letter that was not even his signature of the Grooterskia, where he basically signed that if they need any organs from him, he gives them the full right. I looked at the date on the letter. The day that he's supposed to sign was the same day the doctor told me he's so disorientated, so confused and dehydrated. I did the investigation. I wanted to know how come they let a man like that still sign when it's not even his signature. I showed them his original signature that does not even match up. We had a big thing with them. Eventually my mother just said, you know what, it's not going to bring him back. Let's just leave all this. And I said to the professor at that institute of where that place is, I think it was actually the Lung Institute building, not so far away from Grooterskia. And I spoke to the professor. I said, did you guys take any organs from Mr. Burger? He says, no, we only took some specimens to investigate, to do research. So that's the story of my father.